Okay, now that we know the lingo, A, B, C, and D, let's get to the question everyone has. What's this actually going to cost me? Let's talk about the bottom line. We have the official numbers for 2026, so we can break down exactly what you can expect to pay.
So if you get admitted to the hospital, the first thing you have to cover is the Part A deductible. For 2026, that's $1,736. Now listen closely, because this is a really critical detail. This is not an annual deductible. It applies to each benefit period. A new period starts whenever you're admitted and only ends after you've been out for 60 straight days. So yeah, that means you could potentially pay this deductible more than once in a single year.
All right, for Part B, most people are going to pay a standard monthly premium. In 2026, that's set at $202.90. And if you're already getting Social Security benefits, this amount is usually just taken right out of your monthly check, so you don't even have to think about it.
On top of that monthly payment, Part B also has a simple annual deductible. This is just the amount you have to pay out of pocket for your medical care each year before Part B starts to chip in. For 2026, that's $283.
Now, this right here is maybe one of the most important things you need to understand about Original Medicare. Once you've paid that annual deductible, Medicare steps in and covers 80% of most of your medical bills. That's great, right? But you're on the hook for the other 20%. And here's the kicker. There is no yearly cap, no limit on that 20%. Your costs could just keep going up. This one fact is the main reason why so many people decide to get some kind of extra insurance.
Okay, so we've covered the parts and the costs. Now we need to talk about something with huge consequences, the ticking clock. With Medicare, when you sign up is every bit as important as what you sign up for. Seriously, missing your window can have major, lifelong financial penalties. Your first, and honestly, your most important deadline is called your initial enrollment period. It's this 7-month window that's built right around your 65th birthday. It kicks off 3 months before your birthday month, includes your birthday month, and then runs for 3 months after. Think of this as your golden opportunity, your one shot to enroll without any risk of penalties down the road.
So what happens if you miss that 7-month window and you don't have other health coverage from, say, a job? Well, penalties. And they are no joke. For Part B, your monthly premium goes up by 10% for every single year you were late. For Part D, it's 1% for every month. And these aren't one-time fines. They get tacked onto your premiums for the rest of your life.
Okay,